Attention deficit disorder is a widely diagnosed disorder in the population today. Some believe that it's overdiagnosed. Other disorders can mimic ADD, and so it's important that an accurate diagnosis be made. For example, when a person is being bullied, they may have symptoms that look like ADD. If the person is being treated badly at home, they may have symptoms that look like ADD. So it's important that an accurate diagnosis be made and collateral information be obtained in order to make the correct diagnosis. Attention deficit disorder, when it's properly diagnosed, can be a very challenging disorder to treat, and is more challenging for the patient because the patient can't function well in a number of areas. One of the most prominent is educational. And what young people report to me, what adults report to me, let's say a college student, is they have difficulty focusing on their work. They have difficulty with sustained attention. They sit down and do their homework and they can't stick with it and they don't know why. It's not because they don't want to, it's because their mind wanders. They're distractible, and sounds, voices, things around them distract them what they're trying to do, and so they can't pay attention to what they're supposed to be doing. They also get told by people that they don't listen well because either they're daydreaming or they're distractible and they don't hear what you're saying. So people repeat it and then they say, "What's wrong with you? You just don't listen to what I'm telling you." I think parents tell kids that a lot with ADD kids. And there's an aspect of ADD that's hyperactivity. And you can't mistake that for anything else. The kids are all over the place. And adults fidget and they feel like moving. They're restless. They get up from their desk and they move around. They change their papers around and so forth. But the adults may have hyperactivity as well. Another aspect of ADD is impulsivity. And that's a part of ADD that's fairly common. And people do very impulsive things, say things, do things without thinking them through. They may interrupt people. The teacher is saying something at the blackboard and the ADD child will interrupt or stand up and say something. And that's just the impulsivity of the ADD. There are many more symptoms of ADD. The point of ADD is there really is very good treatment for it. And we have a wide variety of medications that we can use. Sometimes we have to use a combination, but generally the outcome is good. And people then are able to function as you and I do. They're able to accomplish their goals. They're able to be productive. They're able to graduate college. I recently saw a college student who was in a junior in college and doing very poorly academically and finally decided to get a psychiatric evaluation. He is now on medication, getting good grades, doing his studies, and is successful. And that's the way it should be, successful. If you have anybody you're concerned about having ADD or someone that you would like to have evaluated or assessed, give me a call at 908-305-6404.